Hi everybody, this is Johnny. Today we're going to be doing a video on cartilage piercings. We're going to be doing the Helix and walking you through that. So I'm going to introduce you to all the tools that we're going to be using. These are the jewelry itself. Everything is in an autoclavable package. These are our catheter needles, and we're going to be using a flashlight. I'll show you what we're going to be doing with that. And we're also going to be using forceps to tighten everything up, and some alcohol swabs. Here we're going to be using the alcohol swabs to clean the area as best we can. You want to make sure you get into all the crevices and disinfect everything possible. Also get all the little baby hairs and stuff out of the way, so that they're out of the way and don't get in the way of the needle there. The other thing we're going to do is the flashlight. We're going to shine that through the ear. That way we can see all of the veins in the ear, and when we mark off where we're going to put it, we don't want to intersect any of those veins. The reason for that is obviously it's going to make it bleed a lot more if we pierce into a vein, and if we're able to avoid them, it reduces the pain and also reduces the healing time, because the body doesn't have to bypass a vein while it's healing. And then we're always going to take that and the marks and show our client, make sure that they're happy with where it is. Sometimes I give more than one option if there's a bunch of spots available. However, there's no veins. Now we're going to take out our catheter needle, and you get a firm grip on the ear. We're going to be using titanium jewelry that's internally threaded. That way the post has the receiving end, and then the tip is the area which you screw into the post. This is best because it's going to be the most comfortable for the client and give the best healing. So we're going to pierce the ear with the catheter needle, and then what we do is remove the needle, and then there's a plastic sleeve left over in the ear. Now we're going to take the post end, which is a labret, and we're going to thread that into the sleeve that we put in, and then all you have to do is pull the sleeve back through the ear and make sure the labret doesn't fall off. That way no sharp objects or anything like that is poking the ear, and then it slides right in really easily. Now we're going to grab the head of the jewelry, which generally contains the crystal or jewel part, and we're going to screw that into the post. Now we're going to take our forceps, and we're going to just grab onto the post, not on the ear or anything like that. It's just grabbing onto the post. There's always a little bit of room for swelling, and then you can tighten it. That way it just doesn't fall off while it's healing. And we're all done with that part. Now what we're going to do is just kind of dab it with a Q-tip just to make sure no fluids or anything like that are coming out, and make sure everything's nice and clean. And we're all done there. Now what we're going to do is we're going to pierce the lower helix with titanium hoop. So same thing, catheter needle into our marked area, push it right in there. Then what we're going to do is pull the needle out and leave the protective sleeve. Now we have to put the hoop into the sleeve, and that way when you pull it through, none of the edges or anything like that catch on the inside of your ear, and it makes it nice and smooth and easy transition. And then this is a titanium segmented hoop, and then all we're going to do is click them together and make sure it's nice and tight. there. Again, we're going to just dab it off with a Q-tip, make sure everything's nice and clean, and that there's no, again, fluids or blood or anything like that. I also like to do this because a little bit of the marker is left over, and it's purple. It's best not to have that on the ear, so take off as much of the purple as I can, and that way when you're walking around the rest of the day, you're not having a big purple blob in there. Now we're all done with that. Just to line everything up, and we're all done. That's what the ear looks like when we're all done. Now we're going to take all of our needles and our marker and everything like that. We throw it into a sharps container, and then it's disposed of. This is our after the piercing. And, thank you very much for stopping by.